So Sally, just delighted that you were willing to come on board and co-chair this meeting at the Royal Society on Vaccines and AMR, from Science to Policy. Could you tell us a little bit about where you think vaccines sit and what their importance is?
Well, I started life as a paediatrician, so I know how important vaccines are for saving lives. I wish we had higher levels of vaccine coverage, but we know that vaccines against bacterial pathogens prevent infectious diseases. That saves the use of antibiotics and therefore antimicrobial resistance. Those vaccines save lives too. Meanwhile, a lot of people don't realise that vaccines against many of the viruses, particularly flu, actually protect people from bacterial infection too, and therefore save lives and save us from antimicrobial resistance. So vaccines are central to the prevention agenda for AMR as well as generally.
Thank you. And something that's perhaps underappreciated at times, but beyond just the clinical aspect, and one of the things we're trying to achieve from the meeting is that connection between the veterinary space and the human clinical space as well. Could you say a little bit about that and perhaps what's going on and what we might be able to achieve that would be better?
Well, I think we need more human vaccines, but if we need them for humans, we really need them in the food chain. We know that for salmon and trout, it is possible to use a mixture of 3 vaccines and get rid of antibiotics out of farmed salmon and trout. Why are we not doing that all over the world? Why are we not finding the equivalent important vaccines for other fish farming? After all, that farmed fish protein is the protein that's going up fastest in production and in eating. Meanwhile, we also know you can take antibiotics totally out of poultry production if you use vaccines. So there's a big place for vaccines in the whole food chain where there are animals, and likely for plants too. And we really need to explore this, make them, prove their worth, and then make them affordable.
Finally, obviously, as UK Special Envoy on AMR, you've got your eyes on the high-level meeting at the United Nations General Assembly in the autumn. And can you just say something about your hopes for what we might be able to achieve from the meeting in relation to looking forward to that high-level meeting?
So a high-level meeting at the UN General Assembly, it's our second, we had one in 2016, is a political moment. And so we'll get lots of people standing up and talking about what their countries are doing. But the important thing is the negotiated outcome document. What will the world commit to do differently? And actually, we know we need to do things differently. There's something about improving access to the essential drugs needed for human security and food security. There is a big thing about vaccines, making sure vaccines, sanitation, hygiene, infection prevention and control are rolled out effectively, particularly in middle and low-income countries. R&D, how do we get access to innovation in low-income countries? All of this needs money. Is there some money that can be put in? And how do we drive it if we don't measure it? So surveillance becomes central, reporting to the quadripartite on surveillance, but then putting in early targets, perhaps based on already existing guidance rather than new ones. But it's a political negotiation. So the best we can hope for is lots of gritty action things, and what we mustn't lose is the momentum that the meetings before, raising awareness and showing where action is needed, and then afterwards, as we move into other meetings, trying to get that momentum and go up a step at a time.